Hello, I'm Dr. J. Matthew Knight, MD, here at Knight Dermatology Institute in downtown Orlando, Florida. 90% of all skin cancers that aren't melanoma are caused directly by ultraviolet light exposure. That means going outside on a nice day or using tanning beds. The most common form of non-melanoma skin cancer in the United States is something called basal cell carcinoma. This is often a red, scaly, bleeding lesion that comes up out of nowhere, and it prompts a visit to your doctor or your dermatologist for something called a biopsy. It's often treated by a specialized technique called Mohs micrographic surgery, excision, or sometimes things like radiation therapy, depending on the patient. As long as it's adequately treated, everything's great. What you don't want to do is let it go. Even though it's a tiny lesion and it seems like it's very small, unfortunately, patients are sent in to us with basal cells that have been let to linger for several months or even years. In these cases, while these lesions don't get into the bloodstream and go to other parts of the body, they can be locally destructive and cause a lot of problems. Bottom line, if you spent time in the sun as a youth and it's 20, 30, 40 years down the road, and you notice a non-healing spot on your skin, it's time to visit with a board-certified dermatologist to make sure your skin is healthy. If there's any question, you need a small biopsy taken and that'll show what's going on. Even if you do have basal cell cancer and it's treated early, you're going to be just fine as long as you're in the right hands. Just don't let things go, and remember, take small, tiny lesions that seem like nothing seriously if they're causing you problems.